So let me rephrase whatever I'm saying so far, whatever I've said so far, sorry. Um, so when you get the case note, so initial 5 minutes, you have no other options except reading the case note, right? Then 45 minutes left. Oh, sorry, 40 minutes left. What do you do with those 40 minutes? That's the question I want to ask you. Geeta and Sureka. Do you put timer or not? If you don't put timer, of course you're making a blunder. Even if it takes 1 hour for you to write a letter, you still have to put timer for 40 minutes so that you at least know that, okay, I'm not able to complete the letter in the designated time. Now, so once you get the case note, obviously you read it once, I guess, right? What do you do after that? I mean, when do you start writing? Or once you know that you have to write, you start writing? How do you prepare and how do you plan? That's the question.
Sir, important point होला टिक लगाएर अनि I start writing.
So how long does it take roughly?
It takes time त लगाउन it takes 1.5.
No, no, not 1.5, not the total time to write. I mean, the total time to plan is what I'm saying. So once you begin the writing, okay, initial 5 minutes, you have no other options. Okay, you're not doing the practice in this way. So you begin writing straight away after you underline the points?
No, sir, I plan for that.
You plan.
Yes.
So how do you plan? For example, can you share your experience, this particular letter? How did you plan? What did you think about this letter?
For this letter, sir, I wished I write in. Wait. Okay. I started here by writing that bad procedure is successful. So I.
But you've not written about anything about the VATS procedure in your letter. There's no mention. Oh, this is Gita's letter, of course. Okay, you've written that. Uh, so what else? What other thoughts that came into your mind? I mean, we've done many letters. We have experience writing letters. I mean, when you saw that, the person who's receiving the letter is the oncologist. I mean, what thoughts came into your mind? I mean, what did you think about writing in the second paragraph or first paragraph?
सर ब्याड प्रोसिडर सक्सेसफुल्ली डन भनेको थियो चाहिँ मैले अनि सेकेन्ड प्याराग्राफमा चाहिँ अब यसलाई सक्सेसफुल्ली रिलेटेड गर्नको लागि चाहिँ त्यो प्रोसिडरहरूमा चाहिँ कुनै कम्प्लिकेसनहरू चाहिँ आएन भनेर चाहिँ त्यो कनेक्ट गर्न खोजेको.
Mm-hmm. Okay, I get that. All right. See, you should change your perspective. Think the date also matters there, and see if you include all the information that is given in the case note. Let me show you the case note, and then you're going to understand it better. If you mention each and everything that's given in the case note, first of all, it's going to cross the word limit. There's a there's a lot of information. We have a lot of information in this. Um, uh, Case note. Check this. So you're a charge nurse in the oncology ward, looking after Mr. Jeremy Taylor, 55-year-old, 54-year-old patient. First of all, it's very easy to spot that this is a transfer letter. Then we have all the details there. Treating doctor Meena saying, okay, you can mention, you cannot mention. That's an option. Doesn't matter. Social background out of everything that is there. I mean, maybe we can mention the next of kin daughter, who's going to be the caretaker of the patient after the patient is transferred. Okay, we can talk about that. Stressful life, and this is not the concern of the oncologist. If you're writing to a community nurse, if you write to a community nurse, then yeah, okay, he depends on takeaway food and he doesn't do any. I mean, he needs certain prompting and blah blah. Since the patient has lung cancer, 10 cigarettes per day since the age of 16 definitely is a significant information. And he has tried minimizing the number of cigarettes that he smokes with various interventions, but none of them have succeeded. You can also mention if you really want to, but there's a way to do it. So yeah, okay, hypertension is ongoing, doesn't matter. No family history of cancer, not significant here at the moment. So the patient first presents, goes to visit his daughter on March 5th. And it turns out that he has upper respiratory tract infection. And then the doctor, the attending doctor, whoever that was, just prescribe the patient amoxicillin, and that's it. And when the patient presents again on, how many days? 5 days later, he was diagnosed with a certain type of cancer. That is stage 2A non-small cell lung cancer. Now, CT scan also told you the type and the size of the tumor and everything. After that, about 5 days after the diagnosis, the procedure was performed, finished. And then 2 days after the procedure was performed, the patient was discharged under the daughter's care. After that, it must be home to hospital, yeah, on a follow-up basis. So from March 20th till May 20th, that's the duration of March, April, May, 2 months. Um, Chemotherapy started, and there was also issues with leukopenia, for which certain medications are given. Now, discharge plan, of course, everything that is mentioned here is directly important to the reader from the reader's perspective. But now the question is here. So Mr. Jeremy Taylor is a 54-year-old patient in the oncology ward of a hospital in which you are the charge nurse. He is transferring from here to Abbott. Transferring, it's already given there. It's clarified that it is a transfer letter. So the first thing that I'm surprised, like why to go for neutrality in your intro if you already know that this is a transfer letter because there are cities involved. This is a confirmed transfer letter. If there's a shadow of doubt about the type of letter, then you go with a neutrality. You go neutral, like I'm writing in regards, I'm writing pertaining to, I'm writing with respect to, or something like that. But this letter doesn't, you don't need to be neutral. You can go directly to transfer the patient under your care after being uh, after the radiochemotherapy or after being treated or who's under the treatment for a certain type of thing. So here, the things that you mentioned, for example, the 4 incisions, we have tubes removed the same day. Paracet for breakthrough pain. Okay, hypertension is an ongoing issue. We can mention that because the patient has been hypertensive for a while, since 2010. Now, check it in the discharge plan. In the discharge plan, do you see any mention of any, like, for example, painkillers? It's not there, right? Here, I mean, does it show, is there anything there in the discharge plan that the patient has some infection at the incision site or something, or where the tubes were in situ? It's not there. So it is not an ongoing issue. We do not need to tell this the oncologist about, the tubes were removed the same day. Because if you mention everything, the letter is going to be extremely long. What we have to do actually is to write objectively. Writing objectively is from the eyes of the reader. Reader is an oncologist. Tell. So, what do you think? You guys are nursing professionals. I mean, any health professionals would know that, okay, first of all, we need to mention what type of cancer it is. Since the person who's receiving the letter is an oncologist, he would be curious, isn't it? What kind of cancer it is and how was it treated? Okay, we mentioned about the VAS procedure and there was no complication. You can just give a statement, successful VATS procedure was performed. After that, from the chemotherapists, not from the chemotherapist, sorry, from the oncologist's perspective, what do you think? Which information do you think is important? Tell the patient is currently under radiochemotherapy with, chemotherapy with certain agents for a duration of 2 months. And the same thing has to be carried out after the patient is transferred to your care. These things you tell first to the reader. What are the ongoing issues? The patient has leukopenia, for which certain medications are prescribed, and ongoing hypertension, for which the patient already is on ramipril 5 mg. These are the things that you tell in the second paragraph, of course, including what procedure was performed, right? Then, yes, this whatever you've written is fine. So you can also write what are the ongoing issues during chemo and radiotherapy. The patient has lost weight, obviously, that needs to be monitored post-discharge. And if a dietitian needs to be involved, can be involved, you can mention that later. A social background, okay, you're drinking alcohol and cigarette smoking again, right? Here, directly relevant because we're talking about the psychotherapist who is going to be involved in the patient's smoking habit. At the time of discharge, he was referred to a dietitian to gain. Okay, dietitian's interventions required for proper or for better weight gain or for the weight that was lost during chemotherapy or during the chemotherapy. Remove the exercise and everything here. You can talk about the exercise is recommended. Yes, it would be highly appreciated if you could manage a tailor. So that's definitely not acceptable. The You don't put the in front of name first of all. Then the name is always going to be capitalized. I don't need to tell you these things. Yeah, of course, we have certain instructions regarding the repetition of CBC and then chest X-rays and CT scan. You can even put this information in your closing. So in light of the above, the patient's CBC has to be monitored weekly for a period of 2 months, including chest X-ray and CT scan. That has to be done. You can mention in the closing as well. So here, it's very detailed. You've put many information that is actually not needed. You can be objective directly in the second paragraph to tell the ongoing issues and whatever is happening to the patient in the second paragraph, and then go whichever direction you want. You are all going to rewrite the letter for sure. Let's check other letters first. Um, Check this out. Dr. Gerald Jones, the designation of the reader is not there. He's an oncologist. You have to mention that at the top. So the first letter that we checked, the date was wrong. So this is correct there, May 20. That's the time when, the sessions for chemo is over and the patient is moving to the place where the patient belongs to. Dear Dr. Jones, correct. So you have a comma at the top. There's going to be a comma at the bottom. Okay, no complaints about that. I'm writing this letter to transfer Mr. Taylor into your care with his treatment summary and follow-up care. Why would you not tell what is going on in this? Remember what is going on and what you need from the reader, the very basic. The intro, the content of the intro should always contain two ingredients. Number one, I've told this repeatedly, what is going on with the patient, right? What is Currently the patient is receiving chemotherapy after successful VATS procedure for certain type of cancer. You can mention there, and requires your follow-up care. Requires your care after the transfer. After the transfer, Mr. Taylor came. Now another problem is summaries spelling is wrong. I mean, spelling errors cannot be forgiven at the end of the day. It's still a language examination. Mr. Taylor came to visit his daughter in Brooksbank. During his visit to daughter, he was admitted to our center on this date. He had respiratory infection. Why do we need to tell so much? Why do we need to talk about amoxicillin, 500 mg, twice a day for 5 days? I mean, that was a long time ago. Where are we now? We are in May 20th, and you're talking about the details of March 5th. I mean, yes, you can mention what interventions did we do, but the part of the lungs already resected and thrown away. What is the point telling about these things? Here in the second paragraph, especially, I have always advocated the fact that the relationship of the first paragraph with the second paragraph is paramount. It's very important that you crack the relationship between the intro and the second paragraph. So, from the oncologist's perspective, mentioning the type of cancer, how it was diagnosed, and what is actually going on at the moment at the time of transfer is going to be the important information. Where, where is that information? It's not there. During the stay, the test revealed this cell lung cancer and CT scan revealed. Yes, these are the things you need to mention up front. However, bronchial branches, okay, you can mention that as well, are not or were not involved affected. He undergone, that's completely wrong. He underwent, or he had undergone VATS procedure, which was successful in removing the tumor. No, um, you have not judged the letter properly. Tubes were removed in the same night, dressing was done for the situation. Obviously, it was done. But since the patient doesn't have any complications, I mean, we do not need to talk about the tubes. We do not need to talk about the dressings because it's not a recent thing. The patient already was operated March 15th, and we are actually in May now. So we do not need to tell anything. Of course, the blood pressure was managed. High blood pressure was managed with Ramipur 5 mg. That needs to be continued. He was discharged on this date under the care of the daughter. On this date, the patient. Why do we need to put the there? Adjuvant chemotherapy in 4 cycles. Once every week performed to prevent risk of relapse. Where's P in the relapse? Um, okay, side effects. Why do hide such important information inside a parentheses? I mean, the usage of parentheses should be a minimal. I mean, that's such a significant information, that's medication. Why do we need to hide it? Just release it outside in a normal sentence. And Zofran administered for side effects. Why is there a semicolon before Zofran? And he has lost 5 kg. Okay, borderline leukopenia, absolute neutrophil count. I mean, when you read this, do you think this is a sentence? Borderline leukopenia. See, let's read it. Borderline leukopenia. Let me use my pointer. Wait. Borderline leukopenia, absolute neutrophil count at this, and subcutaneous injection. What are you trying to say? It's not even a complete sentence. Borderline leukopenia, absolute neutrophil count, subcutaneous injection. What are you trying to say? Regarding his social and medical background, he is banker. He is a bank. Okay, you can mention social things, but not too detailed. He lives alone and does not perform any exercise. He smokes 10 cigarettes per day since the age of 16 and has a history of hypertension since 2010. Okay, you can write that. As per his discharge plan, he needs to be seen by a dietitian to gain 5 kg for optimum gain. What the clue that the case note is giving is that he had lost 5 kg during the chemotherapy that needs to be covered. The patient needs to gain appropriate weight after the discharge, which he had lost during chemotherapy. I would like to request you to approach uh, psychotherapist to help. That's wrong. It became quiet. It's quit, Quit. Please take a note that where's a comma after a dependent clause? You need to put a comma here. Remember, minimal usage of comma, using too many commas, not using a full stop, using capital in the place of small, and vice versa. Never liked by the assessors. He needs to begin regular and mild exercise in 2 weeks. I would like to request you to monitor complete blood count. See, the problem with the letters, all the letters that we've so far, it doesn't have any vision. It doesn't have any preparation. You're not thinking from the perspective of the reader. You have to think objectively. You're mentioning too many information, first of all. So many information, so much information already there. And it's not coming in sequence. It's not a proper storytelling. Doctor, so again, you've forgotten the designation of the person, whoever you're writing to. You can put, I mean, what is his position? He's an oncologist, isn't it? Dear Dr. Gerald Jones, you can write full or just shorthand, Dear Dr. Jones, Mr. Jeremy Taylor, 54 years old. I'm writing regarding Mr. Taylor, write shorthand, who has been diagnosed with, okay, he has been transferred to care for continuous care and support. Okay, instead of diagnosed, who's been operated with VATS for this, you can write, yeah. On this date, Mr. Taylor admitted in our hospital with a respiratory infection and rust-colored sputum. Tests and CT scan were performed, which revealed, okay, makes sense, whatever you've given there. He underwent, removed the there, successful VATS procedure. The tube, we don't care about the tube. Okay, you can say that to counter increased or elevated blood pressure and pain, Ramipril and Percocet were instituted respectively. Therefore, he was discharged under his daughter's care. So you think when you're using therefore, that's a connector. It's a complex connector. If you're using therefore, so do you think that tubes are removed the same day? Ramipril was prescribed for hypertension. Percocet was given to faint. Is that the reason why the patient is discharged under daughter's care? We do not need therefore to be written here because when you use therefore, it reflects the previous sentence. I mean, Ramipril 5 mg for hypertension and Percocet was given. That doesn't have anything to do with the discharge, right? So you cannot associate things in this way. So remove therefore, just simply write he was discharged under his daughter's care. Yeah, 2 days after the procedure. That is 17th, isn't it? So previously, Mr. Taylor was living alone. That means he lives with somebody now. Okay, you contrasted. However, he will be living with his daughter and son in future. Okay, he used to eat only takeaway food. Nah, we don't care. He smokes 10 cigarettes per day and drinks occasionally. I mean, he has a history of smoking since the age of 16. That's significant information, which he has tried to reduce, but has not been able to successfully do. Therefore, you can just put a psychotherapist counseling or consultation is required. You can add directly here if you want to. Considering the above, Mr. Taylor, nah, you cannot use considering the above. When you use considering the above, it already means that you're trying to close the letter. Usually, considering the above, in light of the above, is used for closing the letter. I mean, here the assessors will think that you're trying to close the letter already. Regarding the disability, it requires a referral to a dietitian to gain his lost weight 5 kgs. No, the sentence not coming in sequence. He also requires psychotherapist assessment to quit smoking. I would highly appreciate if you could monitor to continue Ramipril 5 mg and complete blood count. You don't need to expand CBC for 2 months. He also requires mild exercise, which can be begun in 2 days. Sorry, in 2 weeks, and manage the CT scan in 3 months. How many ands have you used? Why to connect and make it such long sentence when you can do something simply? Don't complicate your sentence if you're not capable of expanding it properly. And manage the CT scan in 3 months, and then annually, and chest X-ray. How many ands do you need in one sentence? If you think that forming long sentences is a problem, better break it into multiple pieces until you get it right. So you couldn't manage the letter. This one's the mistakes, serious mistakes. Okay, let's talk about it further. Since we've already finished checking all the letters. Yeah. See, logic is very simple. Put yourself in the shoes of the oncologist, and then everything will come into perspective. So, like this letter is for let's transfer of Mr. Da, 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 Mr. Taylor, who, oh goodness, who underwent a successful VATS procedure for the removal of, you can even give the type, removal of da 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 da, da of tumor, categorized with a category. You can write from the case note, you can copy paste. Well, it's written like, T10 something, the subcategory of the cancer, right? Finished. After this, you simply go, currently, Currently, Mr. Oh goodness, Taylor has received 4 cycles of chemoradiotherapy. Oh, no, sorry, chemotherapy. The patient has what is leukopenia, which is being treated. What is the name of the medication? Currently, the patient, you can even, currently we've already used. The patient has leukopenia, which is being leukopenia after chemotherapy. DHERAPY, which is being treated with da 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 and da 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 for nausea, right? The patient or he has also lost how many kg? 5 kg. 5 kg. Therefore, uh, therefore, uh, therefore, a referral, or therefore, best would be, therefore, involvement of uh, is warranted. You can also go alternatively like this. If you don't want to write this like this in this form, you can also write like this. See, initially, Mr. Taylor presented with upper respiratory issues that was later confirmed as type this, blah, 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 tumor with a CT, something like that. You can establish the diagnosis. The aforementioned surgery was without any complication. Yeah. Then you go with chemoradiotherapy. It's an important, significant information for the oncologist, isn't it? Warranted means chayo. We need that in future. After that, go in any direction. You can to give a little bit of social background of the patient. Right? Here you can talk about the personal habit of the patient and then go the discharge plan. The discharge plan that you guys have written is correct. There's no issue. There are no issues with it. But you need to very simply depict the picture to the oncologist. You do not need to beat around the bush mentioning, everything that is needed. The tubes were removed, and this was removed, and that was removed. The dressing was done, obviously. But imagine this procedure was performed 2 days ago or 3 days ago, and then you're transferring to the oncologist. Yes, you need to mention the tubes were removed recently, but that's old news. So I'm just briefly telling how it should be written. So Basically, these things, this is the way you write. You can talk about the current status of the patient and then go initially, or you can start initially how you came to the conclusion that the patient had cancer and what is the basis of the VATS procedure, then say what is going on, and then talk about a little bit about the social background and the personal background, and then the discharge plan. Finished, right? So organization of the letter is questionable for all of you. I mean, all the letters I've checked so far. Now, let me tell you, what do you do with the letters? See, first of all, when you have the case note in your hands, right? When you have the case note in your hands, in the exam, what happens is the initial 5 minutes, you're not supposed to write anything. So that's the time solely given just to read. So why waste it? Just read. What do you need to find out during those 5 minutes? Find out what is the purpose of the letter, who are you writing to, what kind of letter it is. When you go towards the end of the case note, you'll come to realize that that's a transfer letter. I mean, the reader's information is going to be given. Whoever is going to receive your letter, his information or her information is going to be given at the bottom. And it also tells what actually needs to be done. What should you make the reader do at the bottom? So these two information that we have should be included in the intro, right? After that, the 5 minutes over, right? You kind of know that, okay, this is a transfer letter. Okay, this is a referral letter. Okay, this is a discharge letter. So I'm going to do this, I'm going to do that. At least you're acquainted. Okay, the patient came to see his daughter, diagnosed with cancer, surgery already performed, already started on chemotherapy, has few issues that's been countered with medication, right? So you get the overall picture. You form a story in your mind that, okay, this is what is going on with the patient. You can fit the story in your head in those 5 minutes because you're not allowed to use the writing devices anyways. After that, how do you manage your 40 minutes? 45 minutes, isn't it? So I know in the initial phases, sorry, in the initial phase, you'll not be able to finish the letter, especially with, especially the difficult ones in the designated time. What you actually have to do is check on the timer, like how long does it take, but still put 45 minutes timer first so that you kind of know that how much extra time you're needing to complete the whole letter, right? Then, so the 40 minutes start. After what do you do in those 40 minutes? You start writing straight away? That's again going to be a blunder. What you need to do is out of this 40 minutes, you need to give good 10 to 15 minutes to plan what are you going to do with the intro? How am I going to frame my second paragraph? The sequence of the letter, I mean, after the second paragraph, which paragraph is going to come? Is it going to be a social history or is it going to be the initial presentation? Is it going to be the chemoradiotherapy or whatever is going on at the moment? I mean, you have to think about that. You know that the blank paper. So let me show you something. The official OET paper has 3 pages, two for the fair work and one for the rough work also is provided. So you should use that paper. Let me show you. Here you go. So this is the facade, I mean the front page. So this is your page 1 and then we have page 2 and see there's a blank paper. What it says, space for notes and rough draft. Only your answer on page 1 and 2 will be marked. Why not to use this paper, this page properly? By that I mean, so giving 10 to 15 minutes to frame your letter, to actually design your letter, to frame your paragraphs, to organize your letter is very, very important. If you don't give that 10 to 15 minutes, usually the letter leads to failure in my experience. What you do is, once the 40 minutes begins, put an alarm initially, maybe 10, 15 minutes, and see, okay, I'm going to include this information in my intro. Okay, my second paragraph is going to be about the initial presentation. Then maybe my second paragraph is going to be about the current issues of the patient, since I'm writing to the oncologist. So I mean, whatever thoughts you have, at least you need to put it on the paper and organize it. And once you're kind of sure, okay, this is what I'm going to do, then you also have to question unnecessary things. Like, I mean, the patient lives with a dog, with two dogs. I mean, how is that going to be important? I mean, like, I'm giving you an example. Uh, the patient is eating from, food, ordering food from Meals on Wheels or something like that. How is that relevant to the oncologist? It's not important. Right? Of course, you can tell that, it's going to be daughter and the son-in-law is going to take care of uh, the patient. You can mention somewhere at the bottom of it, but they are unimportant things. They are not immediately important, but you kind of can mention that towards the end. Yeah. So after a proper planning is done, then only you should proceed further with the letter. Otherwise, don't go ahead. Don't write because you have to write. You should never start writing until and unless you don't have a plan. If you haven't planned, maybe take longer during the practice session at home when you do the homework at home. But give significant time to organize the letter and to figure out where you're going to put which information. If you don't do that, of course, usually the letters, it'll be all mixed with different information coming at the wrong time. Like all the letters that we've checked so far, all of them have problems. They're not organized properly. The homework is going to be to rewrite, and if you fail to write, then we'll do it again in the class. So tomorrow I'm going to check this letter, the rewrite live. Yep, since it's a difficult letter and it's a new type of letter that you guys are practicing. All right. The rewrite, we'll check live tomorrow. That's the homework. Then let's go to other parts.